The top stories tonight in Y News. Malacanang says no COVID-19 alert level 4 for Metro Manila yet.
Deltacron, a combination of Delta and Omicron variants, has been detected in Cyprus, and this new variant is feared to be more dangerous.
Groups of healthcare workers oppose shorter isolation period and call for mass hiring instead.
And 164 killed, including a 4-year-old girl in anti-government protests in Kazakhstan.
Good evening, Philippines and the world. We are now reporting live from Quezon City. Today is Monday, January 10, 2022. Join us in the next hour as we deliver today's top stories around the Philippines and in other parts of the world. I am Herlene Delgado.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am Elsie Marcos.
First in the news. A new variant of COVID-19 called Deltacron was detected in Cyprus. The variant is feared to be more dangerous. Aiko Miguel will tell us why.
Pulmonologist and president of the Philippine College of Physicians, Dr. Maricar Limpin, says Deltacron might be more dangerous for it is a combination of the deadly Delta and highly transmissible Omicron variant. But she says further studies are needed to determine the characteristics it exhibits. 25 cases of Deltacron have been reported in Cyprus. Dr. Limpin added that the Deltacron might be similar to Omicron, which was first detected in India.
We expect sa ganitong klase, highly transmissible din dahil di ba may Omicron genetic is like structure siya, no? Tapos ang mahirap dahil nandoon din si Delta, maaaring itong kombinasyon na ito mabilis na ang transmission at pwede ding mag-cause ng severe. But that is something na hindi pa natin alam. Pero mag-iisip ako na baka ito yung parang mas nakakatakot yung kombinasyon na ito.
In a statement, the Department of Health assured the public that the recently discovered variants of COVID-19, Deltacron, Omicron, and Ihu are not yet detected in the country, and that they are closely monitoring and studying the different emerging variants. Meanwhile, infectious diseases experts Dr. Edsel Salvania and Dr. Ronjin Solantes said that co-infections like Florona or COVID-19 and influenza are not unusual.
This is actually not unusual. It doesn't mean it's a major breakdown. It's an unfortunate confluence of events na na-expose ka sa dalawang pathogens. And of course, may kinalaman dun if you have comorbid conditions, kung may diabetes ka, kung meron kang hypertension. But it's not unusual to see co-infection in these cases.
The country has recorded its first case of Florona last January 2020. The patient was a 44-year-old Chinese national. Based on his record, he had influenza B and COVID-19. He died and was recorded as the first death due to COVID-19 outside of China. Experts advise those who are most vulnerable to get their flu and pneumonia shots before the flu season. Flu, pneumonia, and COVID-19 vaccines should be administered at least 2 weeks apart. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Metro Manila mayors have recommended to the government to retain the alert level 3 status in the National Capital Region amid the rising number of COVID-19 cases. Meanwhile, a group of physicians hopes that the government's policymakers will also consider the healthcare workers in deciding the alert levels. Herlene Delgado will tell us why.
The mayors of Metro Manila see no need to raise the alert level in the National Capital Region to alert level 4. This as the country registers record high number of COVID-19 cases amid the highly transmissible Omicron variant. Metro Manila Development Authority or MMDA Chairman Benher Abalos says the mayors have recommended to retain the current alert level system due to several factors, including the healthcare utilization rate in the metro at 51%, which is within the alert level 3 classification. He also cited the resolution recently passed by the Metro Manila Council restricting the mobility of unvaccinated individuals. Abalos also showed photos of the major thoroughfares and shopping malls in the metro over the weekend, saying that the public is now regulating themselves and going outdoors.
On their own, talagang nagsiself-regulate ang mga tao. Let us also consider na halos 100% vaccinated na ang Metro Manila, ang mga kasama. And of course, isipin natin na kaya lang tayo mag-alert level 4 is to restrict mobility. Ibig sabihin, yung dating 30% sa restaurant na indoor magiging 10, yung dating 50% magiging 30 sa outdoor, no? Ultimo ang DOH ang nagsasabi right now there is no need for alert level 4.
He also condemns those who are reportedly spreading fake news and sowing panic through audio clips and wants them to be jailed. Meanwhile, a group of doctors says hospitals are still trying their best to manage the increasing COVID-19 numbers. Philippine College of Physicians President Dr. Maricar Limpin says emergency departments of the hospitals in Metro Manila are now experiencing an increase in patients, but the ICU rooms and regular wards are still manageable. However, she notes that more and more health workers are now getting infected as the demand for testing continues to increase.
Pero syempre, pag hindi na namin kakayanin, doon kami hihiyaw. No? Pero for now, kinakaya pa namin dahil marami naman doon sa mga pasyente ang ginagawa talaga namin. Inopen na namin yung aming sarili for teleconsultations, no? So maybe maganda din na pag-isipan na ng gobyerno bago talaga umabot doon sa pinaka parang sukdulan, ano? Yun yung ano natin. Pag-isipan na yung possibility na iakyat sa alert level 4.
Dr. Limpin hopes that the government will continue monitoring not only the number of hospital beds and ventilators, but also the welfare of health workers.
It is not just about the numbers of cases na meron tayo on a daily basis. Hindi lang din yung utilization ng mga hospital beds, but kailangan tignan din ho natin at i-consider ho natin yung number ng mga healthcare workers na magiging available po para tumingin sa mga kababayan natin.
Jorlene Delgado, UNTV News and Rescue. We serve the people. We give glory to God. The palace says the National Capital Region cannot be placed under COVID-19 Alert Level 4 yet. However, Malacanang ensures the government is actively monitoring the COVID-19 situation to decide immediately if there is a need to escalate the restrictions in Metro Manila. Rosalie Cons will tell us why.
Currently, the healthcare utilization rate in Metro Manila is at moderate level. This is though the 2-week growth rate and average daily attack rate of COVID-19 in the capital is already high. Acting Presidential Spokesperson and Cabinet Secretary Carlo Nograles says there's no need to place Metro Manila under COVID-19 Alert Level 4 since it has not reached the threshold yet. The palace official adds the metrics must be met first to escalate the restrictions in the capital. It was Health Secretary Francisco Duque III who mentioned that there is a probability that Metro Manila will shift to Alert Level 4 from the current Alert Level 3 amid the surge of COVID-19 infections. This is to prevent the healthcare utilization rate from reaching moderate risk level. But Nograles assured the national government will not hesitate to escalate the alert level status of Metro Manila if deemed necessary. For Presidential Advisor on Entrepreneurship Joey Concepcion, on the other hand, Alert Level 3 is enough since the mobility rate during the first quarter of the year is usually low.
Karamihan ng mga kaso ay mild. Halos karamihan ng mga tao, dyan lang sila sa bahay. Pati mga opisina namin, medyo we have lesser people in the office kasi marami rin ang nakasakit. Whether we are in level 4 or not, it's the same thing. We already have a first quarter that is relatively matumal, plus the people are scared to go out.
Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
After shortening the isolation period of fully vaccinated health workers to 5 days, the national government is now eyeing to implement the new protocol to the fully vaccinated population. Arlene Cerudo will tell us why.
The country is in need of manpower, especially in hospitals, quarantine facilities, and testing laboratories. With fully vaccinated individuals having enough protection against the virus, Presidential Advisor for COVID-19 Response Secretary Vince Dizon said shortening quarantine periods would help in maintaining balance in the country's economy and other services. Discussions are still ongoing on whether to also implement shorter quarantine and isolation period to the rest of the fully vaccinated population. The new protocol is only applicable to health workers.
Pero pinag-aaralan na rin po ng ating mga eksperto ang ginagawa sa ibang bansa tulad ng Amerika at Europa na nagpapaigsi ng isolation lalo na para sa mga bakunado na. Pinag-aaralan po natin yan at hopefully po magkakaroon tayo ng mga pagbabago sa ating mga pulisiya sa mga susunod na linggo. Pero sa ngayon po, healthcare workers lang po.
Under the new protocol, fully vaccinated health workers will undergo isolation for only 5 days if they tested positive for COVID-19 and are experiencing mild, moderate symptoms or if they are asymptomatic. Fully vaccinated health workers who were in close contact with a COVID-19 positive patient no longer need to undergo quarantine as long as they are not showing any symptoms.
Basta wala na pong simptomas at bakunado, pwede na pong bumalik sa trabaho, pero syempre kailangan talagang sundin ng stricto ang minimum public health standards, yung pagsusuot ng mask at lahat ng mga precaution natin para siguradong walang hawaan. No?
The Alliance of Health Workers, however, opposes the new protocols, saying that it might cause the further spread of COVID-19. The group also reiterated the right of health workers to rest amid the ongoing surge of cases.
Yung mga health workers ay tao rin po kami at dapat hindi pag-ibahin yung sinasabi na 10 days na isolation and then gagawin lang kami ng 5 days. Hindi naman kami immortal.
The Philippine College of Physicians also expressed their apprehension. PCP President Dr. Maricar Limpin said health workers exposed to a COVID-19 patient should still undergo 3 to 5 days of quarantine.
Parang medyo apprehensive ako kasi masyadong parang baka yung tao na na-expose kung nagkataon na positive yon tapos nandoon siya sa mga ospital, no? So you can just imagine ano magiging impact nito, baka mas lalong maraming healthcare workers.
In order to address the lack of manpower in hospitals and other medical services, the Alliance of Health Workers called for mass hiring and not shorter isolation period. Eileen Cerudo, UNTV News and Rescue. We serve the people. We give glory to God.
The Department of the Interior and Local Government has given its guarantee that unvaccinated individuals will not be arrested. Leia Ilagan will tell us why.
Department of the Interior and Local Government Secretary Eduardo Año clarified that unvaccinated individuals will only be asked to go back home and will not be arrested if they are caught roaming around in areas under COVID-19 Alert Level 3. In an interview, the official said that individuals will only be taken into custody as a last resort if they refuse to follow the mandate or present falsified documents. Those apprehended for using forged requirements will also be charged in court. It can be recalled that President Rodrigo Duterte ordered village chiefs to arrest unvaccinated individuals who will caught roaming around. Based on an MMDA resolution, those who are yet to be vaccinated have to remain in their houses unless they have to attend to some special errands such as buying food, medicines, availing medical services, public utilities, and work. There are checkpoints manned by the Philippine National Police in strategic places in Metro Manila to make sure that the directive is being implemented accordingly. Leia Ilagan, UNTV News and Rescue. We serve the people. We give glory to God.
The Philippines' new COVID-19 cases soared to 33,169 today. This new figure is the highest single-day tally since the pandemic began. Today's new cases pushed the cumulative count to 2,998,530, of which 157,526 are still being treated. Of the active cases, 4,994 patients show no symptoms, while 147,912 have mild symptoms. 2,858 are in moderate condition. 1,461 have severe symptoms, and 301 are in critical condition. 145 more fatalities were confirmed today, bringing the death count to 52,293, or 1.74% of the total case count. However, 3,725 more patients recovered. This figure raises the recovery count to 2,788,711, or 93% of the overall tally of cases. Meanwhile, the overall global COVID-19 caseload is now 297,896,231, while the deaths have surged to 5,466,645, according to Johns Hopkins University. The USA remains as the worst-hit country with the world's highest number of cases and deaths at 60,090,328 and 837,664 respectively, according to the CSSE. In terms of infections, India follows in the second place with 35,707,727 cases and 483,936 deaths. In terms of deaths, Brazil comes second with 620,251 fatalities.
Some COVID-19 testing facilities are not able to submit released test results on time, and it is not just because of the sheer volume of tests that they need to process. JP Duenas will tell us why live. Yes, JP, go ahead.
Yes, Harleen, good evening. Usually, COVID-19 test results or RT-PCR tests are processed within 24 hours. But recently, it is taking 2 and sometimes 3 days before patients are able to get their COVID-19 test results. Presidential Advisor for COVID-19 Response Secretary Vince Dizon explains that it has become challenging as medical and laboratory technicians have also contracted COVID-19, which affects the manpower of testing facilities.
Ang pinakamabigat dito, kaya humihingi po tayo ng pasensya sa ating mga kayan, marami po sa ating mga technician, mga medtech, mga laboratory technician ay nagpo-positibo din po at sila ay kinakailangang mag-isolate at hindi po sila nakakapag-report sa trabaho. Yun po talaga ang pinakamabigat na hamon natin ngayon.
However, Secretary Dizon says that the government is continuously addressing the issue.
Yun po talaga ang malaking paghamon natin ngayon. Pinipilit po natin mag-activate pa ng ibang mga swabber, ibang mga laboratory technician para po mapabilis natin ang ating mga testing results, no? At ginagawa din po natin ngayon sa mga area tulad ng NCR na napakadami ng dagsa ng mga nagpapatest. Yung pong mga ibang mga sample pinapadala natin sa ibang mga lugar na hindi naman ganun pa kadami ang nagpapatest para po mapabilis natin ang turnaround time.
As of January 7, an average of around 81,200 COVID-19 tests are being processed every day, even if there are groups asking the government to conduct massive free testing for all. Secretary Dizon admits that even if they want to, the government doesn't have the resources. Around 200 million pesos is needed to support free mass testing.
Unang-una pong rason dyan ay ang resources. No? I-compute na lang natin, halimbawa, Yusek Rocky. Assuming na ngayon nagtetest tayo mga 80 to 85,000 a day. Assuming itaas natin to 100,000 a day. 100,000 a day times 2,000 na lang, no, yung ating current cap at average ng ating test ng PCR. 200 million po yun kada araw. Kada araw po, 200 million. Sa loob lamang po ng 10 araw, 2 billion na po yun. So talaga pong unsustainable at talagang hindi po nakarapat dahil gaya po ng sinabi ni Yusek Vergere at ni Dr. Salvania, mag-test ka ngayon, ma-expose ka bukas, pwedeng magka-COVID ka na. Kaya kailangan po talaga risk-based ang ating testing.
Harleen, Bayan Muna Party List Representative Carlos Zarate was among those who are asking the administration to conduct free mass testing as well as aggressive contact tracing and ramping up of vaccination amidst the rise in COVID-19 cases. That is our latest live. Back to you, Harleen.
Thank you, JP Nunez, reporting live.
Several presidential aspirants have presented their programs regarding the COVID-19 pandemic. Meanwhile, Senator Panfilo Lacson reiterates that there is not enough time for the Senate to tackle the proposed charter change. Nel Maribihok will tell us why.
Presidential hopeful Senator Manny Pacquiao expressed the need for the government to intervene in the problems of healthcare workers by increasing the minimum wage of all medical professionals, including those in the private sector. Pacquiao insists that nurses, medical technologists, pharmacists, and other healthcare professionals should have a minimum salary of 50,000 pesos on top of perks such as the special risk allowance. According to him, 50,000 pesos is still very low compared to salaries offered in other countries, but it might be enough to convince some of the workers not to leave their families or the country. Vice President Leni Robredo led today the swab cab in Novaliches, Quezon City. This is an initiative of the Office of the Vice President that offers free COVID-19 antigen testing. In her live Facebook broadcast, Robredo said there are many people who are lining up and want to avail of the free service, so they need additional manpower.
Yung mga naka-PPE po, inaayos lang nila para makadagdag tayo ng stations. Yung mga nag-positive po ay meron na po naghihintay na ambulance.
Presidential aspirant Senator Panfilo Lacson says the Senate has no time to tackle anew the proposed amendments to the 1987 Constitution. This after Pampanga 3rd District Representative Aurelio Gonzales Jr. filed a proposed resolution that seeks the lifting of term limits for the President, Vice President, and all other elective officials. Gonzales also calls to convene Congress into a Constituent Assembly to introduce the amendments to some provisions of the Constitution. According to Lacson, if it didn't happen last year, more so now that they only have a limited number of sessions left, not including the joint session of Congress to convene as the National Canvassing Board for President and Vice President. Meanwhile, Manila Mayor Isko Moreno Dumagoso reiterated that non-Manila residents can avail of the anti-COVID-19 drugs from the Manila City government. The official said that they have sufficient supply of Remdesivir, Tocilizumab, Baricitinib, and Molnupiravir. Meanwhile, Ferdinand Bongbong Marcos Jr. has no activity today as he remains in isolation after being exposed to at least 2 COVID-19 positive individuals. His camp also refuted some speculations regarding his failure to attend the COMELEC hearing on petitions filed against him last Friday. Nel Maribuhok, UNTV News and Rescue, we serve the people, we give glory to God.
Commission on Elections Commissioner Rowena Guanzon said that the poll body will ask for the notarized medical certificate of former Senator Ferdinand Bongbong Marcos Jr. Dante Amento tells us why.
Presidential aspirant Ferdinand Bongbong Marcos Jr. failed to attend the preliminary conferences of his 3 disqualification cases last Friday, January 7.
Content for respondent. Is Senator Marcos Jr. now on Zoom or video?
Your Honor, I personally haven't received any information that he is present already via Zoom.
The precon was delayed for over an hour because BBM's camp did not present immediately a medical certificate to justify his absence.
Why is it very hard for Senator Marcos to go on video? He can do that in his phone. You call Attorney Araneta Marcos.
According to his lawyer, Attorney Hannah Barcena, the former senator was not feeling well the day before the hearing and his condition worsened after attending a radio interview. But Guanzon questioned the lawyer that if BBM is allegedly sick, then why did not submit a medical certificate? Thus, Guanzon said that she will order BBM's doctor and lawyer to submit a notarized medical certificate. Meanwhile, Akbayan Party List, one of the petitioners, asked the poll body to hold Marcos in contempt for allegedly lying about the reason for his absence during the preliminary conferences of his disqualification cases. Marcos's camp is yet to release a comment regarding the issue. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
The nationwide gun ban took effect at midnight of Sunday, which also marked the start of the election period for the 2022 polls. According to the Philippine National Police, they have already arrested 5 individuals in their checkpoints for illegally carrying firearms. The PNP reminds the public that it is prohibited to bring guns outside of residence without an exemption from COMELEC.
Tuloy-tuloy po itong ating pagpapatupad ng COMELEC gun ban at iba pa hong mga checkpoint operations to make sure of the public safety at yung ating din pong pagtupad sa election duties.
The police also asked for the motorist cooperation at COMELEC checkpoints, which have been established in various areas across the country.
And still to come, NY News. 164 people killed, including a 4-year-old girl in anti-government protests in Kazakhstan. And decision to cancel top tennis player Novak Djokovic Australian visa overturned. COVID-19 cases continue to rise in the United States. As a result, public health experts are warning about the threat of the Omicron variant to the country's healthcare system. Maeve and Dog will tell us why live. Go ahead, Maeve.
Harleen, almost a quarter of hospitals in the United States now suffer from critical staffing shortage because of the surge of COVID-19 cases, particularly fueled by the Omicron variant. On Saturday, around 138,000 COVID-19 patients were admitted to U.S. hospitals, and more frontline healthcare workers are either getting infected or being forced to quarantine due to COVID-19 exposure. Because of this, nearly 1,200 out of 5,000 hospitals are experiencing a critical shortage of staff, according to data from the U.S. Department of Health and Human Services. Dr. Ashish Jha of Brown University School of Public Health said on Sunday that this is their biggest concern, taking into account the need for staff to care for children and adults suffering from conditions other than coronavirus. Dr. Jha said the situation is made worse by the large number of unvaccinated people, as well as those who have not received booster shots yet, as they will end up exhausting hospital resources. Harleen?
So, May, what is being done to mitigate the hospital staff shortage in the U.S.?
Harleen, some facilities are requesting permission from the state governments to implement crisis standards of care. This means that they are seeking legal and regulatory protections and guidance by the state government because the healthcare system is overwhelmed by the current pandemic, and they are not able to provide the normal level of care to their patients. Some facilities are also forced to cut elective surgeries in order to safeguard hospital capacity. Elective surgeries, Harleen, are those that can be safely scheduled in advance. For example, in New York, due to low patient bed capacity as well, 40 hospitals have been told to stop non-essential elective operations for at least 2 weeks. Back to you, Harleen.
Thank you, Maeve Yandog, reporting live.
More than 100 protesters took to the streets across France on Saturday. The Interior Ministry said this number is 4 times bigger than the December 18 protest denouncing COVID-19 restrictions. Ruth Bahe tells us why live. Good evening, Ruth.
Good evening, Elsie. Indignation against President Emmanuel Macron's words towards the unvaccinated pushed more than 102,000 protesters in France to take action. The head of state was quoted by a Parisian newspaper saying he wanted to piss them off. in relation to unvaccinated citizens. Macron is planning to implement a new law that will limit the movement of people who have not been vaccinated against COVID-19. They will be hindered from going to bars, restaurants, and other leisure activities, as well as taking long-distance public transport. His vaccine pass plan, which is now making its way through the National Assembly and is scheduled to come into effect on January 15. The largest protest was in the capital city with 18,000 demonstrators. They were supported by several far-right personalities, including presidential candidate Jean-Frédéric Guanzon. Other smaller protests were held in several parts of the country, including Lyon and Dijon. A demonstrator in Bordeaux, who was not anti-vaccine, said that she was marching for the first time in her life because President Macron's words had been the straw. While in Montpellier and Toulouse, authorities said there had been incidents of clashes between the protesters and the police. Elsie?
Ruth, how many people have been vaccinated in France as of this month?
Yes, Elsie, based on the data from France's Public Health Department, 77% of their population have received 3 doses, while some 4 million French adults remain unvaccinated. President Macron is very insistent that 100% of their nationals should be vaccinated to curb the rise of surging Omicron cases. Back to you, Elsie.
Thank you, Ruth. Bahe reporting live from Vietnam.
164 protesters, including a 4-year-old girl, have been reportedly killed in deadly anti-government protests in Kazakhstan. Law enforcers have also arrested over 6,000 protesters. Marvi Delfin will tell us why live. Yes, Marvi, good evening.
Good evening, Harleen. The protests, which started on the 2nd of January, suddenly escalated into a nationwide riot after being initiated by the public over increasing fuel prices. Kazakhstan's President Kassym-Jomart Tokayev was quick to respond to the public's concerns, reducing fuels to 50 Kazakhstan tenge per liter. But the display of anger with the government continued. The week of protests were full of acts of violence, with some seen taking over public and private property, as well as burning down buildings. Because of this, Russian troops were called over to restore civil order, where nearly over 6,000 people, including foreign nationals, have been arrested. President Kassym-Jomart Tokayev announced on Friday in a statement that order has been restored in many parts of the country. Officials have taken back buildings which the rioters, who they label terrorists, took over, and constitutional legitimacy is being restored. But the situation in Kazakhstan remains hostile as the president ordered the country's law enforcement to open fire at any terrorists who continue to damage public and private property when necessary. The United States Secretary of State Anthony Blinken expressed disagreement with the actions and decisions of President Tokayev, claiming that the shoot-to-kill order is not at all acceptable and should not be used to maintain order. Harleen?
Marvi, was there any response from President Tokayev regarding Secretary Blinken's statement?
Well, Harleen, in his statement, President Tokayev actually referred to those from abroad who criticized his shoot-to-kill decisions as nonsense, expressing his belief that no peaceful resolution can take place where criminals and murderers are committing violence. And to those families who have lost their loved ones, the president extends his sincere condolences. Back to you, Harleen.
Thank you, Marvi Delfin, reporting live.
The federal government's decision to cancel Novak Djokovic's visa has been sensationally overturned by a judge, allowing the Grand Slam tennis player to stay in Melbourne. On Monday, a federal circuit court judge ruled that the tennis star should be released from detention and overruled the government's cancellation of his visa. His visa was canceled last week after authorities determined he did not qualify for a medical exemption from the country's COVID-19 vaccination requirement for all arrivals. However, it is unclear if Djokovic will now participate in the Australian Open or whether the government will extend legal proceedings.
And before we close, we will leave you with a word, giving glory to God. From the book of Romans, chapter 13, verse 7. It says, "Render therefore to all their dues, tribute to whom tribute is due, custom to whom custom, fear to whom fear, honor to whom honor."
And those are the reasons behind the news, January 10, 2022. Reasons we deliver to you as they unfold. I am Elsie Marcos.
Because we need to know, we will always ask why. I am Herlene Delgado. We serve the people, we give glory to God.
We expect sa ganitong klase, highly transmissible din dahil 'di ba may Omicron genetic is like structure siya, no? Tapos ang mahirap dahil nandoon din si Delta, maaaring itong kombinasyon na ito mabilis na ang transmission at pwede ding mag-cause ng severe.
Whether we are in level 4 or not, it's the same thing. We already have a first quarter that is relatively matumal, plus the people are scared to go out.
Tuloy-tuloy po itong ating pagpapatupad ng COMELEC ban at iba pa hong mga checkpoint operations to make sure of the public safety at yung ating din pong pagtupad sa election duties.